Hi, in this video I'd like to talk about trauma and the PTSD, the long-term PTSD that women develop after experiencing repeated miscarriages and the management that we do offer here at Antai Hospital. So the trauma that I'm referring to specifically, I mean PTSD, which means post-traumatic stress syndrome, PTSD. This is what a lot of pregnant women, after miscarrying just one time alone, is sufficient to make it quite severe and long-term, persistent, and they are unable to overcome it. So for women who experience repeated miscarriages, even 2 or 3, it's far more severe and long-lasting. Now, a lot of doctors, even loved ones of these mothers who have gone through miscarriages, are unaware that these women are very mentally fragile and also fearful of the pregnancy journey. Let's say they have a history of miscarriages. For their next pregnancy, if they want to have a child again, they will be extremely anxious, extremely stressful, and whether or not they show this is a different topic entirely. Many of them hide these types of emotions inside them because they don't want to worry others, and many doctors also do not really put any emphasis on managing this stress, managing the trauma first before going to pregnancy. These women, sometimes the stress becomes so severe that they may develop into hysteria, hallucinations, and can go on to be quite severe, and then it may even affect their mental health in the long term. These women, if they go on to pregnancy directly without receiving the proper management beforehand, the slightest discomfort, slightest interruption or annoyance, let's say they experience some discomfort in the stomach or some discharge in the vagina that has nothing to do with any miscarriage, this alone can trigger a lot of fear in them, a lot of stress, because they believe it's going to happen again, and it brings back these memories, these images in their mind. It can be a very vicious cycle, and this fear and pressure itself can potentially lead to another miscarriage because mentally the mother is very fragile, very affected. So we do not advise any women who have gone through miscarriage to directly go for another pregnancy, because you must manage this trauma both mentally and physically. Physically, you are well recovered, but the mental part is very difficult. And here at Antai Hospital, we put a lot of emphasis in this part. We understand it very well. No matter if the mother is showing it or hiding it, we know that it is present, and we like to discuss about it and offer you the support that you need. So at Antai Hospital, what we provide is a combination of medication and therapy. This is what we find to be the best approach to helping women overcome it. We try to make it as gentle, as smooth as possible, and we try not to be too invasive, and also let the mother do most of the talking, and then we offer supports where it's needed. So medication is a combination of antidepressants and anti-anxieties to help them calm the nerves, and then for therapy, we usually have a professional individual to actually prescribe some oral therapy where they are discussing the trauma and helping them unveil the emotions behind it, discuss why they happen, and why they should actually gain strength from it, learn from the experiencing, not to let it hold them back. We have doctors and specialists that actually specialize in talk therapy. The act of talking about trauma alone is already can alleviate a lot of stress mentally, because some mothers are uncomfortable discussing these private matters with their loved ones, because this can strain relationships. Even family members, they are uncomfortable with talking about this. But if it's with a professional therapist, they are more likely, because the goal is to help them. So over a period of a few months, if you follow our regimen strictly, which is the medication and the therapy, you can actually overcome this trauma. Now, not many hospitals can offer you this kind of support and management, because they expect you to overcome it yourself, or they believe that it doesn't affect you much, and then they also urge you to go for your pregnancy immediately as part of your helping you recover from the trauma, which is one of the worst mistakes can actually make it far worse. So do receive the mental support that you need from Antai Hospital, where we give you medication and also therapy. The next step, of course, if you are familiar with our process, is that we need to diagnose and treat the underlying cause. But we do want to put more emphasis on the mental health here because it affects a lot of women and many people are unaware of it as well. If you are fully recovered mentally and physically, then you have the green light from our doctors. Then you can go on to conceive, and trust us, you will have a very successful, healthy pregnancy journey. Do not worry because you can have a healthy baby. All you need to do is just learn from the mistakes, receive the support that you need, and a healthy pregnancy can be had. So get in touch with us via the website if you'd like to talk about these traumas, past traumas relating to miscarriages, and also if you'd like to receive support, get in touch via the website. And also do visit our other channels, our other social medias, our websites. We do have daily content uploads.